this is a really good time for this. I talk a lot about getting tested and using those test results to guide your health decisions. So what I'm going to do today is kind of take y'all through my micronutrient portion. So full disclosure, I'm gonna let you see everything that we tested. I'm a big fan of the SpectraCell test and what that tells us. So I'm gonna show y'all what that looks like, and we'll dive into some of this. I'm weird. Whenever something pops up on my blood test, I kind of get excited. Like when I've got something that's off in there, I want to dive into why it's off and exactly what has changed in my previous 6 to 12 months that may have caused that result to change. So, you know, whatever that deficiency or change might have been. So let's see. Let me see if I can do this actually. Hey, there we go. Let me know if y'all can see that. Give me like a thumbs up or something like that. I'm not sure if I think I'm doing that right. Okay. So no comments. Come on. I'm not going to show y'all unless y'all tell me you can see it. So hopefully we can get into some of this and answer some questions about some of that. Doing these tests. So I recommend at least once a year doing a micronutrient test, and the results from this can really be used to make some very good decisions. You really can get in there and find out what exactly you're dealing with and what blood levels you have. And once you've done some of this stuff and you can start to go into, okay, how do I get myself healthier? How do I actually make some dietary changes, make some supplement changes, some activity changes that really, really can guide your health. And I think this is the basis of a lot of the anti-aging stuff. A lot of the things that you could do to keep yourself healthy for longer is getting really good tests done in there and really diving in and finding out what's in your body and how to improve that before we start adding a bunch of extra stuff in there. So when you finish your test, this is what you get. This is the results page that they send us or your provider or directly to you. And so when we're looking at this, what happens is they send you kind of a breakdown, and at the very beginning, they give you this results at a glance. So if you're just trying to find out what to do, like, hey, I don't want to know why, I want to know all of this. This very first section is going to give you just the content that you want. Start taking this. A lot of times I'll do it in a supplement. And so what you can see for me is I've got an abnormal vitamin B2. So take 20 milligrams of riboflavin is their recommendation based on the tests. And I'll get into that in a second. There's a secondary thing that we would want to look at with that. So if we keep rolling down in here, this will get some provider comments if you have anybody like reading this. And so some of these borderline ones are really where we would want to take a look at from kind of the future testing standpoint. So a lot of this stuff is very interesting because these are the downstream effects of a lot of times what your deficiency is. And so this is stuff that I would actually want to pay attention to and make sure that you're doing things to elevate these. So this is a part where a lot of people scan past these borderline things. But if you're doing this for health and aging, you want those borderline effects to be perfect. Like we want all of these tests to guide us in how do we optimize our health? How do we really get to the point where our health is pristine? And I don't want to be in the mid-range for a lot of these things. I want to be as perfect as I can get. So that's where a lot of this stuff comes in. Anything borderline, pay attention to that stuff. Those are really, really helpful. And then this is something that I really like that they do. And that is where they're breaking down and telling you what is your like total antioxidant function, which is going to be a very, very big part of staying healthy and aging. They show you your total immune function. So, checking all of your stuff right now. This is what we're talking about. Do we have a good, strong immune system? And if you're getting down into the average here, we want to do some stuff to climb up. So I take antioxidants. I take glutathione every day. After this test, I'm ramping that up. I'm right on that border. I don't like to be in the average. So, and then if you look at the immune function, we're just elevated. I think some of that, the vitamin B stuff is why both of these are a little bit lower than I would like to see them. So this is really good information when you start diving into this. And then we can kind of get down into your very specific. So this is a really good way that they do this. Mine is very strange in that normally your B vitamins will all drop together. I have a very isolated riboflavin deficiency. I'm digging into why that is and what's happening to bring that into effect. But and one of the things I'd like to do is get a friend of mine on here who talks about like what things can be the downstream effects that would lead to this, and kind of show y'all some of that, because it's really helpful to see what things you're doing in your life might bring some of these changes. So another way of doing this, I could take a riboflavin supplement and get this up. And I probably will, just because of where it's at, go ahead and add that. Another thing that I'll start doing is adding in some sardines. Sardines will bring up all of these B vitamins. And that's really, really helpful there. B5 here, that was a borderline one. That's a precursor to acetyl coenzyme A, and that's really, really important for a lot of the functions in the immune system in the body. So that's something I want to pay attention to. I don't like that being borderline, but for the most part, when I'm looking at this, it's B vitamins. I need to get those in a better place. So I'm going to work on that. I'm going to take this. More interesting to me is, how do I get these elevated, and what has changed? This is not, I've never had an issue here. So what has changed in my last year or so, my last 6 months, that has dropped this? So that's something that I'm digging into. I'm really interested. As I said before, that I get kind of excited whenever one of these things changes, because then I can kind of dive into it and figure out where that's coming from and share that with y'all, and kind of use that as teaching moments. So you can go through all of this stuff right now. We want to make sure that all of these that you got, zinc levels are in a good position. Copper, magnesium levels are in a really good position. So this gives you some really good information. As I was saying earlier, I take glutathione every day. I was borderline with that. For somebody who's paid attention to glutathione, I don't like that at all, that it is not in a really good position. I think that may have something to do with the B vitamins, like I was saying earlier, that those are low, and that can then lead to some other issues of your body kind of holding on to some of the antioxidants. So I'm gonna correct the B vitamins, and I'm gonna dose up a bit on glutathione. And that's what's so nice about doing these tests, is that I'm not feeling any effects. I feel great. Like this is I'm functioning great. I'm not having any physical, mental effects of this, but I don't want to either. I don't want the downstream effects to get to the point where I am having issues, and then I'm trying to dive in, and now I've got deficiencies up and down the board, and now it's really hard for me to correct these things. And that's why I tell people, do this stuff regularly, because if you're doing it before you get symptoms, that's when you can really make these changes and keep functioning at a very high level. It's the same thing with like checking motion, checking sensitivity, stretching, rolling out. If you can start catching issues in the body before it becomes symptomatic, before your neck tightens up so much that it hurts, it just feels a little stiff, we can correct that before it becomes a major issue, before that compression starts to wear those joints away and starts to really irritate the joints. And now you're on the path of inflammation and joint dysfunction and eventually arthritis. If we're doing these checks regularly, that's how we continue going through this life and this aging process, very, very healthy, feeling good. And this is no different, using these results to say, hey, I'm staying ahead of this. And when I see something, it's not a big deal. I'm going to correct it before it becomes, a symptom that has really caused me problems. So that's really nice to find these little borderline areas and say, okay, I've taken CoQ10 back in, 5-6 years ago. I might want to add that back in along with my glutathione. Vitamin C, same thing. I think that's getting used a lot. Vitamin C is a very short acting thing in the body. So your vitamin C levels can fluctuate even throughout a day. And so, this is something that, like, what was happening the week before this test, vitamin C is something that I'm going to start throwing back in every day again. I was kind of doing it when I was going out around people, taking some of that. So this is something that says, hey, that probably just needs to be part of my morning routine right now, especially with everything that's going on. I really want my vitamin C levels to be high. So, then you get down into this, just kind of showing you the same thing, just on a graph result. So this is kind of a repetition of some of those previous ones, just in a little easier way of seeing it. In the white circles mean you're good. Of course, red means, hey, pay attention here. So this is what this stuff would look like whenever we get this. And whenever we get this for a patient, what we want to look for is, what are the things that are affecting your body's ability to stay healthy or to heal? There's another test that we can go through that goes through like your inflammatory levels. That's really important. And then I have another one that's all like the lipoprotein particle sizes, which has a lot more to do certainly with like cardiovascular heart disease, and paying attention to that in our patients who have those issues. That's what we really want to dive into and make sure that those things are paying attention. Inflammation and your lipoprotein are really important to make decisions about your health, about your diet, about your activities. So a lot of times we'll run those two together. And so this kind of gives you your carbohydrate metabolism. So are you very sensitive to sugars? So for those of you who are, that changes things. Like, you may not be able to get away with adding that little bit of sugar in your coffee every morning. That's going to cause a bigger response in your body. The glucose insulin interaction in patients or people who have had issues in the past. A lot of this is like, if we've had kind of some yo-yo dieting, if we've had issues with weight loss, if we've had issues that may have affected our body's ability to produce and be sensitive to insulin. A lot of this glucose insulin interaction will tell us that. And in those instances, that may be somebody that we say, look, hold sugars. That means hold fruit even. So you're someone who, if we're in a dieting phase, we're going to say pull back on a lot of fruit, because we need to keep your insulin levels very even. And we need to make sure that you're not getting those spikes. And even eating fruit in somebody like that is going to cause that insulin spike. And then the stuff you're eating for the rest of the day is just getting thrown into storage. So this can really be helpful if we're trying to get back to that healthy weight. And I think that's a big part when people are trying to get healthy, is taking the steps to get to a healthy weight. A lot of those actions that you do to do that affect you in so many other areas of your health. So, Christy, that's wonderful. I'm glad to hear that you're scheduled for it. When you get it, let us know. We can kind of dive into that a little bit. So, this is what that looks like, and it does go over, kind of what they're doing at the end, and it talks a little bit about the testing and gives you some really good information, actually, like what things affect your body's energy production. So this is really neat to see where they put it in the pathway. I love this because, one, I geek out on these things, but two, it does give you a very clear picture of, when your body is trying to take food and turn it into energy, and really good energy, whether that be physically, mentally, any of that stuff. You have a good picture of, like, for me, right here, when carbohydrates are supposed to be getting broken down into acetyl-CoA, I've got some issues right there. So if I'm eating carbohydrates and my body's having trouble turning those into energy, that could be a problem. That could be a problem that then gets shunted into storage, or then gets shunted into this excess inflammatory response, that can lead to some issues again down the road. So now I see that that's a really, really easy thing for me to fix over the next 6 months. And then we can track that and see, hey, how good of a job did I do? And so that's really nice. Certainly, if you geek out on some of these things and you really want to know if you're low in something, how is it going to affect your body? That's where these results can come into play and really do a good job of explaining, my bottom line energy production, cellular energy for our patients. We're worried about that from a healing standpoint. Like if your body can't produce ATP well, look, that's why we're doing the, infrared therapy. That's why we're doing the pulsed EMF therapy, so that we're getting that optimal energy production from cells so that they can repair themselves. If we're not getting that, it's really tough to heal. And when we're talking about pain, that's a big problem. For energy, same thing. If we're trying to repair cells and not have damaged cells as we go through the aging process, having good cellular energy is a big part of that. And if we're not getting that, that's going to affect the aging process and kind of speed that up a little bit. So this is a really neat way that they do this. And then they dive into kind of the methylation cycle. And same thing, this gives you kind of a really good depiction of how is your body going to detox. We know that when we've got damage in the body, we know that breathing oxygen, when your body breaks down oxygen, it creates exhaust. Basically, when you breathe in oxygen and it breaks that oxygen down, it's like your car using gasoline to go. That creates an exhaust in the body that needs to get cleared out. If we're not clearing that exhaust out and that continues to grow in there, that's the things that end up leading to problems, but also speeds the aging process significantly. So that's why, for me, getting my glutathione levels, your body's master antioxidant, up to a really good optimal level. That's why that's important. This is a really neat graph that kind of shows you how that process is affected by whatever areas you have in your body that are borderline or deficient. How is that process happening? So they do a really wonderful job of educating you after, and we can sit down and go through these results with people and explain what does that mean for you personally, from a diet standpoint, from a supplement standpoint. I always want to attack these things from two levels. I want to attack this from a dietary standpoint. So for me, it's like adding in that food that will correct my B2. So, sardines, that's easy. I can grab that as a snack. I love Wild Planet sardines, by the way. The one that they keep in olive oil is very tasty. Got like a little salty treat there. And so, that's something that I'll add in. And if it is actually deficient and not borderline, I'll go ahead and take the supplement. If I'm borderline on a couple of these things, what I would do if I was you, we're gonna put together a list of foods that correct some of those things if we can. If we can do it naturally, I want to do it naturally. If not, then what are some supplements that I can add in to get those borderline levels up to an optimal level? And when you do these things, sometimes I get patients who say, like, I didn't know how slow I was functioning, or how low my energy was, or how poor my sleep was, until I fixed it. And then I realized, man, now I feel good. I didn't know what I was missing. And when we go through these things and we correct them, a lot of that happens with this stuff. So that's what this looks like. I hope that gives y'all some information. I know that's a lot of getting into some very specifics, but this is really important stuff whenever it comes to health. So if you can really do some things that will clear up your deficiencies, it's so helpful for healing, for energy, for vitality. And I think this is a big part of the aging process. This is another thing I forgot to mention. I love that they do this. When you have something that's actually deficient, it'll tell you some symptoms. So for me, if I was having something, depression, dizziness, any burning or mouth issues, a lot of people will get kind of itchy or dry eyes or any of that kind of stuff. So if you notice one of these deficiencies and you're like, hey, actually, I do have those symptoms, didn't realize it was from something, that gives you kind of a little more kick to get these things back into balance. And then it gives you some food sources. So which one of these can you add in easily? Like for me, almonds, like I was saying, I'm gonna do some sardines there just to get them all up. Eggs. And now that I think about it, I kind of went away from doing like eggs for breakfast consistently. So that might have something to do with this. Possibly. I'm going to dig into that. We're going to come back to that here in the future. But do you have any questions about all of this stuff? Let's see what we got. I popped on late. What is the cost of the testing? So SpectraCell testing can be paid for partially by insurance. And I think if your insurance pays for it, it pays for about half of it. I think that comes out to on the person costing about $250, and the insurance pays about $250. This is kind of dependent on your insurance. So give or take around that range for the whole suite of testing of doing the micronutrient test and the folate metabolism test and the lipoprotein particle size test. I think if somebody's just paying cash for that, that's I think $690 or so for all of that. I think the regular testing, this micronutrient test, is really, really important. And if people are doing like the whole suite maybe once a year and then just adding in, a second micronutrient test 6 months later, then that gets this into a really cost-efficient range, because the downstream effects of this are expensive. Like if you get to where these deficiencies are leading to health issues, now we've got some problems, not to mention like difficulty with energy. But so based on the insurance, a lot of times insurance will pick this stuff up and insurance will help us with it. And that's really nice. So then a lot of times for like consultation after, what we're looking at is kind of having like a full scheduled patient evaluation. Same thing is that if that's involved in patient care, then that can be an insurance thing. If that's involved in somebody who's just paying cash for it, then usually that one's $125 to $150, depending on what we're looking at. So, but this is some wonderful information. And I think even for the layperson, if we do the micronutrient test and we have at least like one sit down and explain these things with people, there's a lot of action that SpectraCell gives you. There's a lot of stuff that they can explain for those follow-up things of what do I do? That second test, a lot of times it's just having a conversation with somebody and kind of telling them, yeah, it looks like for me, my B2 levels are back up. Keep doing what you're doing for another 6-month cycle. Normally, that's another point that I'd like to mention. When I get something that's a deficiency, I want to try and fix it and see at that next blood test if it's better. If it is, I keep doing what I'm doing for one more cycle, for one more 6-month cycle. And then normally at that point, if it's still better, then I'll kind of pull back. And that gives a lot of people, when we're talking about like what vitamins do I need to take? Am I wasting money on a multivitamin? This is how we decide that. And I've had a lot of people that we go through and do this and find out that their multivitamin is not serving them any purpose. And so for them, the money saved with isolating and fixing certain things here and not taking things that they don't need to take pays for the test itself. So that's how we want to use this. We don't really want to just be taking a bunch of vitamins that we don't know if we need or not. And, this gives us some direction to say, like, what do I need to take? What areas am I in a really good level that it doesn't do me a lot of good to be taking? A few years ago, I had a selenium deficiency. I haven't taken selenium in probably 4 years, and my selenium is still in a perfect level here. So, if I had kept taking selenium all along, not that it's an expensive supplement, it's fairly easy, and grab you some Brazil nuts and you've got it fixed. But, being able to knock that out and move that now into like a vitamin B supplement makes my health better. And certainly that's a more efficient thing, financially, which, shouldn't completely be overlooked. And so hopefully that answers it. It does kind of depend a little bit on your insurance if we're using insurance, but I think that truly with what you get health-wise over the years of doing this, the cost is really, really effective. I think it's a really great place for us to be putting money if we care about kind of keeping our health up and improving our health. So hopefully that wasn't too much for you. I didn't lose too many of y'all diving into some of the science behind this, but it's okay. If we did lose a couple of you, come back and rewatch this. This stuff is really important, and I wanted to spend some time on that and explain what we're looking at and why we recommend this test so much. So hopefully that's some good stuff.